All right, and can you all see my screen?
Yes.
Great. All right. And I see that we have our partners in peace from our state partners have joined. So let's go ahead and get started today. I'll be back in a speaking role here momentarily, but I'm gonna hand it over to kick us off to provide some welcoming remarks to Ann Whalen. Ann?
Hi, good afternoon, everybody. Can you hear me okay?
Yeah.
Wonderful. So as Christina mentioned, I'm Ann Whalen. I am the Illinois Early Childhood Transition Director. So I am helping to support the state as we are aspiring to move to one state agency for early childhood programs and services. And we are hopefully, fingers crossed, on that path to have that kicked off July 1 of 2024, but are just thrilled to be in community with this group as we are learning from other states who have gone before us in different aspects of this work, so we can get smarter and better as we embark on this conversation. So just appreciate everybody's willingness to come and join and be part and share in this conversation. Particular thanks to Adrian from Massachusetts and Vicki from Washington and Woody from Georgia, just for your time on a Friday afternoon, as Christina mentioned, but also kind of your willingness to share both what's going well and the what if or what we would have done opportunities as part of the discussion, so we can all learn and build off of each other. Also wanted to do a quick thank you to Richard and Sam from the federal level who are joining us here today. Really appreciate all of your partnership in this work. A lot of this is as a result of investments that the federal government has made and the communities of practice you guys have brought together. So just appreciate all of that. And so excited that we have so many people from both across the country, but also from Illinois, from our Transition Advisory Committee, who represent different roles within our ecosystem, from parents to providers to advocates. So we are here listening from kind of multiple vantage points so we can kind of figure out how we build off of this work in Illinois. So just appreciate everything you are doing to help us get smarter as we embark on this. And with that, let me pass it to Bella Motte, who is CEO and president of the Carol Robertson Center, one of our providers within the state of Illinois, as well as the chair of our Transition Advisory Committee. Bella?
Oh, thanks so much, Anne. Good afternoon, everyone. I'm so sorry. I'm in transit picking up my daughter, so I cannot be on camera, but just echoing thanks. There is much learning to do from others who have gone before us, and really excited to continue to have data conversations as we kind of launch this integral part of the work. So I'll turn it, Christina, am I turning it back to you?
You are, and thanks, Bella. I know you're on double duty right now, so I appreciate you being on the call as long as you can. So again, welcome everyone. And I think it's mostly afternoon for those who are on the call, maybe with a little bit of an exception, but great to have you here. This is the third of 3 learning sessions that I've helped put together to really propel the learning, the peer learning, in thinking about what a new data and learning infrastructure might look like as Illinois seeks to have a single agency for early childhood. Fingers crossed that looks every day, that looks more and more probable to begin in July of this year. And so part of my role is to continue to work with all of you to build a strategy for data and learning. And I'm thrilled that as we develop that strategy together, we'll be kind of rolling up our sleeves with the TAC work group devoted to data and learning launching this month. So we'll be doing that in a more concrete way. And so these learning sessions have been intended to kind of help give visibility into the realm of what's possible. So I've been doing data and learning for a long time. I'm hooked on it. And for me, these moments, these inspiration moments come often where you see a piece of analysis or a data visual and you want it. You want to be able to have that thing for yourself or your context so that you can make a greater impact. And that's truly the power of data. So you all will get that wow factor, that inspiration factor today as we listen from our state friends in Massachusetts and Washington and Georgia. You will get that. but I also want to bring visibility into something else beyond that, which is there is a national dialogue happening where these smart people, including those who are with us today, have really broken down what have been previously barriers to getting to those insights, whether it's, the data is fragmented or we don't have access to the data, or data literacy, whatever it is. These are the champions, and the years that have followed today's conversation, these are the champions who've really broken down those barriers. And Illinois, in addition to be inspired by the specifics that we hear, the specific insights we hear today, Illinois has the opportunity with this new agency to benefit from that dialogue, that movement, and also participate in it with our unique needs here in Illinois. And so just super excited to have our friends here with us. I'm going to kick it off in a minute to have Chris Strauss-Clark introduce the panel. And then we'll hear from our panelists. They'll provide a brief 15-minute or so presentation on the good work that they're doing in their states. We'll follow that with a moderated panel. And then as we've done in our other peer learning sessions, we will, as time allows, break out into additional peer learning discussion. So let me introduce you to Chris Strauss-Clark. He is the CEO of Third Sector Intelligence. And before launching 3SI, about over 10 years ago now, I would say he was a common person just like the rest of us, frustrated also with those challenges in taking data that was already flowing and turning it into insights. And so he left his role at the Gates Foundation, where he kind of had a front row seat, and took a risk, I would say, and started this, what is now a national platform for an early childhood solution, intended to break down those barriers and get to the results and insights that you're going to hear those states have who are with us today. In addition to the 3 states that are here, they've worked with over 20 states in some capacity over that last decade. And so really, if there's a glue and a kind of a motivator behind this national dialogue in early childhood, it's really Chris. And so we're thrilled that he can kick us off here today and introduce the panelists. Following the panel discussion, Elliot Regenstein will do the moderation for the panel questions and discussion, kind of getting a little bit deeper into what these 3 states have been able to do. Elliot doesn't need as much of an introduction. He's in our backyard here. What you might not know about Elliot is, in addition to him also being part of the consulting team for the governor's office, he is also the national expert. Talk about a national movement. He is writing the book on data governance for early childhood on something called National eKids Systems. eKids is Early Childhood Integrated Data System. So we're so lucky that Elliot not only is a part of our efforts here in Illinois, but able to moderate the panel today. So with that, I'll kick it over to Chris.
Thank you.
And feel free, if you do have any questions along the way, please put those questions in the chat box, and I'll help to bring those to Elliot's attention.
Great. Thank you, Christina. Well, first of all, it's an honor to be with this crowd here today. I know there's a lot of people that I really respect and enjoy working with and have worked with a lot. And so it's also just really, really fun to see familiar faces, and those maybe a few faces that I haven't yet been able to meet, but hope to soon. I'm starting with this call. I think my main job today, frankly, is to talk as fast as possible and then get out of the way so we can get to the dream team of panelists. But I do want to just basically set the stage so that the folks in Illinois in particular have a little bit of context of what ties these 3 states together. So Carl, could you bring up our slide deck? Yeah, there we go. So basically, I'm just going to talk again quite fast and try to get out of the way, but I really do want to set the stage here so that you all have the context you need for this panel discussion. So I'll just talk a little bit about the actual platform that all of these states are on. So again, you have sort of the common theme that runs through these discussions. So the first slide, again, just a little bit of context about 3SI, is that we're a software firm based in Seattle that specializes in the early childhood field, and the platform that everybody is on today is called the Child Universal Success Platform, or CUSP, which is an ESIDS. And so if we go to the next slide, the CUSP facts are that we have 5 states that are currently running the platform, and that represents now a little over 20% of the U.S. Nationwide for children ages 0 to 5, and that's in no small part because we have California now, and California is obviously a very big state. In addition, as you can see here with this map, that we have done a bunch of other work in terms of early childhood data. We've done some prep work for Texas and Oklahoma, and then we've done a lot of due diligence, not just for these states in blue, which is more aligned with early childhood data, but we've also done a lot of cost modeling work that we didn't even list on here. So the storyline is that we used to be a consulting firm, actually, and we would be called into states to help them with ESIDS. And ESIDS, as most of this group knows, is a really tough thing to do. And the more we were consulting, the more we realized, wow, if we can create a community of practice, because a lot of states need a lot of the same things, and so if we can figure out how to come up with a platform where states can really share learnings and benefit from a shared platform, then it creates a virtuous cycle where you have economies of scale and again, a community of learning that's built into the platform, which then will really help states and ultimately help children and families in a way that I don't think has been done before. So that's what we're doing, and it's working, and it's really exciting. So we're very excited to share with you some of those the things that our state partners are working on today. So the next slide, again, is the strategic roadmap for CUSP Network is always really to think about the experience of the child and the family. So if you think about any state, you have operational systems such as licensing or subsidy or whatever. And each of those systems, of course, is really meant to, do the transaction that whether it be the licensing renewal or whether it be getting that payment out the door to pay for the subsidy for the child and the family. But at the same time, you need to take a step back and take all of that data and try to put it together in a way that you actually can think about how you are actually what is the child's experience as you go through these steps here. And so it's building blocks, starting with, you need to know who your children and the families that you're serving, and then what kind of services they are receiving, and then enrollment and attendance. Are they able to enroll and then attend in a way that is, they don't have to wait, or that there's service that's near enough to where they live, et cetera, et cetera. And then you get into learning and care experiences and outcomes. And so we have used it's our own version, of course, but we've used things like the STEP framework and EASY framework from EC DataWorks and such to really put all of this together. Now, today, what you're going to see is a concentration probably in 1 through 3. And it's really been interesting nationally, because what's happened is, especially with COVID, there's been a renewed focus on really trying to figure out, okay, access and how kids, especially with COVID, were struggling to attend for obvious reasons. You had more turnover. So there's been a lot of emphasis on shoring up 1 through 3, really understanding our children with unduplicated counts, and then their services, and then how they're enrolling and attending. So you'll hear a lot about that today. Obviously, learning and care experiences and outcomes. Outcomes is the holy grail, so we don't want to lose sight of that. But for today's discussion, we're really going to dig into 1 through 3. Okay, so the next, so this is just sample success metrics, and I'm not going to spend a lot of time on this because I think this is a very veteran crowd, and so they're going to know a lot of these metrics. But we are, tracking a lot of these, or in many states we at the very minimum aspire to track. I would say outcomes is the one that is still somewhat aspirational. And it depends on the state in terms of learning and care experiences, but these we're really focused on key measures of success that are really again targeted for children and families and their experience. Okay, next slide. So the real key here is it's a continuous innovation. So we're literally interacting weekly with our state partners, where they're using the data. Then we, as part of our support, we provide advice and technical assistance. And then what we're doing is we're sort of putting all these ideas from the community together into the product roadmap, and then we're constantly updating the platform. We do quarterly updates that are automatic into the clouds of each of the network members, and it then becomes a virtuous cycle. So that's what what the 3 states that are going to be talking today are on. And again, it's very exciting. It's working great. And I think we're excited to share more about it. So without further ado, then I think I'll introduce the panelists. So the first up is Adrian, Director of Data Analytics for EEC. Then Vicky, who's Assistant Secretary for DCYF, and then Woody Dover for DECAL. And I'm not kidding when I'm saying that this is the dream team. These 3 panelists are. I've been working, and we've been working with them for years now. And I'm really excited that they're going to be able to share their extensive knowledge to this crowd. And you'll see that the progress and the data and the analytics that these 3 states are doing is just really exciting. And personally, I feel just sort of humbled and honored to be a part of it. So I can't wait for this conversation to unfold. And without further ado, I think then Adrian, I'll cue you up to talk first. But thank you.
Great. Thanks, Chris. Let's see. Hop up the slides. But so thanks, Chris. I'm excited to share a little bit today about how EC has worked with the team at 3SI to implement the CUSP, or Child Universal Success Platform, and then a little bit about how we've used that implementation in our work and to drive some policy and program decisions, and really to better understand the early education and care landscape in Massachusetts. Thanks, Carl. Awesome. So I thought to start, maybe we'd start sort of by grounding ourselves in sort of what's this challenge that we're trying to solve with CUSP and with the data work that we've engaged in with 3SI. And I think it starts sort of in our ability and our work to understand the big picture. So, we're really fortunate to have a lot of data in the early education and care space in Massachusetts, and really thanks to the Commonwealth's increased investment since the pandemic, we have more data now than I think we've ever had before. But that data is really largely siloed. We have our licensing data that lives in our LEAD licensing database, and we're able to connect that to our child care financial assistance or CCFA or subsidy data. And then we have a wealth of new program level data that we're collecting through our Commonwealth Cares for Children or C3 data collection, which is the program that began as a stabilization grant funded by ARPA and is now funded by state dollars. So we have sort of that data that talks to each other, communicates, sort of lives in the same universe. And then we have lots of other data on the early education space in Massachusetts that just lives elsewhere. For example, we have aggregate K-12 data from our sort of K-12 sister agency. We have aggregate Head Start data, and then we have data from other sort of locally funded efforts like the Boston's Universal Pre-K program. And so given that all of this data lives in different places and talks to each other to sort of varying extents, it makes it pretty hard for us to answer questions like, how many 3- and 4-year-olds are served in Y town or in the western part of the state. Sort of overall, disaggregated by income, we sort of have these pockets of data that some of which speak to each other well, others less well, and without sort of some intentional effort, it makes it really hard to sort of see the big picture and ultimately understand the count and sort of the universe of children that we're serving. But I think, Carl, if you want to hop to the next slide, I think the challenge is actually even deeper than that, which is even if we could identify the unduplicated population of children that are served, that doesn't really allow us to answer questions about how this population compares to the overall child population in Massachusetts and really to understand who are we not serving, which is also a really key question as we think about the health and reach of our early education and care system. So we're really sort of fundamentally interested, especially in the case of our financial assistance system, in drilling down from the total child population to then the population of children who are eligible for financial assistance, and within that population, the population of children who are actually serving through our child care financial assistance system, both overall and then disaggregated for particular populations. And I realized I should have said at the beginning that I'm happy to answer questions via chat. And Rebecca, I see your question about educator data. We do have some educator data, and we collect through the C3 through the grant program some program level educator data, but we haven't yet integrated educator data here into the platform and so into sort of the schema that I've been talking about here. In part because we're continuing to build out some additional IT systems and data systems around the workforce. So not now, but I think that's certainly a future frontier. Great. So I think so this is where we sort of leverage CUSP to help us answer that question, that sort of big picture question about who are we serving, and then how does that population compare to the population of eligible children or population we could be serving. So CUSP starts with the census data and creates a synthetic child for each child in the aggregate census data. So it says, it takes the aggregate numbers from the census and creates a sort of a child level population that aligns with the aggregate census data. And then CUSP takes actual child level data where it's available and swaps out those children for real children that we know that we're serving through child level data where it's possible. And this allows us to disaggregate even where we don't have child level data. So because we can merge our real children into this this database of synthetic children, allows us, even where we don't know exactly, sort of can't touch and identify the child who we may not be serving, we know a lot of characteristics about that child by our ability to merge the synthetic data into our real data into the synthetic data. And then over time, we've been able to add additional data sources from some of our state-funded grant programs that collect child level data. We've been able to enhance the program with enrollment data that we collect through our through our C3 or stabilization grant program. And so we've sort of done this initial merge that I think Carl is showing with the cool floating graphics. And then over time, we're able to continue to iterate that and make those merges stronger and better and sort of more closely aligned to the model, to more closely aligned to what we know is the reality on the ground. I'm going to pause there because I think that's sort of the technical piece of the conversation, and to just, oh, wait a second, in case anyone has any questions in the chat. Great. We can continue to talk questions throughout. But so this is sort of where I'll transition to talk a little bit about a couple of examples of work that we've done using the model, and how sort of what it looks like and what this model has enabled us to do in the policy space. So we use this data in cost. One use is we use it to identify areas, and in our case, we've chosen zip codes to be able to identify zip codes that are formal childcare access deserts. And so in this work, we look at zip codes that have a sort of sufficiently large population of children, and then we identify whether or not those zip codes have a children to capacity ratio that exceeds 3 to 1. So are we talking about an area that has sufficient seats to meet the potential early education and care demand in that area? And this we've done this, and we've worked with 3SI to do this both sort of for our overall 0 to 5 population, and then also to zoom in on specific age groups and say where may there be enough seats overall, but we have a real serious lack of formal infant care seats, for example, or toddler seats or preschool seats. And then the model allows us, as you can sort of see at the right there, to both measure the intensity or severity of the desert, as well sort of overall and for each of those age groups. And this has been a helpful tool as we think about geographic access around the state, for us to sort of zoom in at a level that's smaller than we have licensing and subsidy or financial assistance regions, but this allows us to really dig in at a deeper level. Rebecca, that's a great question. We currently, through CUSP, we can track the designations that are in the census. So what we look primarily at through the CUSP model currently is family income, not some of those other characteristics, but I think those are also sort of the future frontiers for us to think about as we also have more granularity in our child level data. And no, CUSP captures both our publicly funded seats, and then the model also estimates private pay. We have, for most programs, private pay enrollment through our Commonwealth Cares for Children, or C3 program. So we can use that, the combination of the sort of child level data that we have from our financial assistance system and the overall enrollment that we collect from our licensed providers through the Commonwealth Cares for Children grant process to create some modeled, to include in the model both publicly funded seats and private pay children. Great. So I think two sort of broader examples that I'd love to talk a little bit about, that are sort of two very concrete ways or two concrete projects in which we've leveraged CUSP. And then happy to talk more about other examples. But the first is it's really allowed us to better understand the pre-K landscape and who's served in the pre-K space across the mixed delivery system, which has been helpful in a couple of particular use cases. And then the second is we're currently in the process of procuring our contract provider system, and we've used much of the data from CUSP to inform our strategy there, which I'll talk a little bit more about. First, in terms of understanding the pre-K landscape, the CUSP data has really helped us understand in the 3- and 4-year-old space who's being served across the mixed delivery system, which has been especially important when our governor, the Healy administration, announced a new Gateway to Pre-K initiative, which included a proposal to deliver universal high-quality preschool access for 4-year-olds in all of our gateway cities, which are sort of mid-sized urban centers that are sort of the regional economic anchors across the state. And the cost model has been able to help us to benchmark sort of where are we now, who's being served across our licensed and funded early education and care providers, across our public K-12 system, across our private school system, to be able to understand sort of the full landscape of who we're currently serving, and by virtue of who we're currently serving, also who are we not serving, sort of what's the delta between where we are now in pre-K access for 4-year-olds across the state, but really particularly in these gateway cities. And then sort of what's the delta between where we are now and the universal access that is proposed in the Gateway to Pre-K initiative. So this is really one instance in which being able to know who are we currently serving, who are we not serving, and where are we not serving children has become a really key, has been really key for us and for Massachusetts as sort of the policy design process. I'm going to pause, and I think I see a couple of questions about this piece, and then I'll move to the next piece and sort of tackle the next set of questions. I think I see the question about access to full day or half day pre-K. That's not something we see super clearly in cost. We can see in our financial assistance data the type of care that children have access to, and we know through the we know who's accessing care in the public school space in aggregate, but we don't distinguish now between full day and part day and cusp, which I think is another. All of these are sort of the sort of potential next frontiers as we think about growth and about.
I'm not trying to critique with the questions, by the way.
Oh,
no, it's something we struggle with a lot here. So thank you.
No, and I think I'm sort of chuckling and looking over at Chris here, because I'm taking notes from this chat to be able to think about as we move forward. One of the things that I think has been really key to our implementation of CUSP is that we started with something and we've been incorporating more data, refining the model over time, and so at the end of each year I think back to sort of what the model looked like a year ago and how much more insight it can provide now. And so I'm stealing all of these ideas to go back and think about how, what we can do with the data we have and where we should be thinking aspirationally as we think about sort of the next iteration. So,
and
Chris,
it
right?
also is just such a big deal when we think about outcomes. So we here, my organization was able to collaborate with University of Chicago that did a study on bilingual pre-K, and it found that full day mattered so much more than half day, which other research shows that starting at age 3 mattered so much more than age 4. We know attendance matters. We know teacher qualifications. And so sometimes when we look at outcomes, if we don't understand the trajectory that the kid had, that could help us not understand outcomes. And I also think outcomes that a little into grade school matter too. But the reason I'm just asking that is it's so hard for us here sometimes to know those factors. So I appreciate this, and I'll stop asking so many questions.
No, Rebecca, the questions are great, and I really appreciate them. And I think I should also say that I think the CUSP work is one really key piece, but not the only piece of data work that we're engaged in. And so I think we've been thinking more and more about how are we accessing other data sources, in other ways to begin to get at some of those, some of the key questions, Rebecca, that you're putting forward and that are so crucial. Great. Sorry, I'm not skilled at both monitoring the chat and the presentation. So I think Robin we'll definitely talk about capacity as well, maybe in the discussion too. But so I think the second example that I just want to talk a little bit about, or another project and policy area where we've really been able to leverage CUSP in Massachusetts, is in thinking about our childcare financial assistance or subsidy provider contracts. In Massachusetts, we have two mechanisms by which we distribute childcare financial assistance or subsidies. The first is through vouchers that go directly to families, and then also EEC contracts with providers also to provide services to families receiving childcare financial assistance through its contracts with providers and family childcare systems. And we're currently in the process of re-procuring those contracts with our providers and family childcare systems. And we've been using the CUSP data to help inform some of that work. I think really, Carl, if you want to go to the next slide, great. So really, we've used CUSP sort of at 2 points in the process of the provider contract re-procurement. First, at the beginning of the project, we looked at data. We sort of laid side by side data that we have from CUSP about the population of income eligible children by regions. And then we laid that out directly next to our current distribution of income eligible contracts. And it really helped us to look at and find some areas of alignment and misalignment by region and age group to be able to say sort of what are we currently buying through our contract provider system, and where do we know from this data that our income eligible children live, and where are we hitting the nail on the head, and where might we think about some adjustments as we re-procure the contract system. So it was a really helpful tool for us, sort of strategizing at the beginning of the procurement process. And then secondly, we then in the sort of back end of the procurement process really have been in an attempt to support access in some of the geographic areas that I was talking about earlier that are designated as formal childcare access deserts. So we've included the extent to which bidders serve children in childcare access deserts as part of the evaluation criteria, again, to really support access in those areas for our children served by contract providers. So I sort of throw those out as two recent examples of ways that we've used this tool in collaboration with program teams across the agency to sort of inform some policy and program decisions. But excited to, I think this is both an evolving tool and we're evolving in the ways that we use it in Massachusetts. And so excited to also hear more from other states about their use of the tool and excited to walk away also with some examples from the chat of where we might go next. So I think I've been trying to keep an eye on the chat, but if I have missed questions in the chat, please speak up and feel free to ask them verbally. Otherwise, I'll turn it back over to Chris.
Okay, great, Adrian. Thanks so much. So without, again, I'll just pass the mic to Vicky.
Good morning. It is still morning on the West Coast, so good to be with you all today. Thanks for inviting me. Go ahead and put the slide deck up, Carl. My name is Vicky Ibarra. I'm currently serving as Assistant Secretary for Partnership Prevention and Services at Department of Children, Youth, and Families in Washington State. We are the Uber agency. We used to have a separate Department of Early Learning, and in 2018 became a joint agency with Early Learning, Child Welfare, and Juvenile Justice. The work I'm going to talk about today, we completed when I was in a previous position as Director of our Office of Innovation, Alignment, and Accountability, the agency's Research and Data Unit. Next slide, please. It was great to hear Adrian's example of how CUSP has evolved and their use of it has evolved over time in Massachusetts. We have a similar trajectory, although most of this talk will concentrate on how we've applied the data, how we've used the data in unique and helpful ways as we've moved our policy out for improvement and expansion. Our work with CUSP and its precursors started back in 2013, in a QRIS pilot where we were just in the beginning stages of developing our QRIS system, and we're able to have some federal grants to help support that work, and that predated my time with the agency. We then moved on after I came on as research director at the Department of Early Learning. We started what we called an underserved populations project that started helping us look at eligibility segmentation, capacity gap analysis, extreme access deserts. So similar to what Adrian shared in Massachusetts, access deserts were really important for us to look at, where we have the most unmet need. We use extreme access deserts, from Aaron Hardy's work, also in Massachusetts, because if we map just access deserts in Washington state, it's about half the state. So we need something that would get us a smaller group of zip codes or local areas where we could focus efforts. CUSP has also been used to inform facilities expansion, early learning facility expansion in King County, our largest urban county in the state. It helped to justify some bond work for facility expansion, and was really useful there when there was some public transit dollars available to do facility expansion. And then most recently, and this is what I'll talk about today, we have used the CUSP data to help us in both the implementation and evaluation of a large piece of state legislation that we call the Fair Start for Kids Act, where we used public dollars, primarily from COVID ARPA funds, to push out a lot of money to early learning providers in an attempt to not only maintain the system and not lose capacity during the pandemic, but also to prepare and strengthen our early learning providers for the next step of expansion and quality improvement. Next slide. So I think over the course of that, decade of work, we have really benefited from this iterative process, working with 3SI on what is next, what is the data going to be most useful for, what is our next priority, and thinking together about that and then implementing it in an iterative way. With administrative data, it's been important to refuse to wait for perfect data. There is never perfect data with administrative data. And for folks who insist on waiting for perfect data, we would probably never have gotten anywhere. But the data are good enough to be able to do the kinds of estimates that we need to do to target populations to serve, as well as to inform policy and systems improvement. This is really population and system information. It is not a tracking system for individual children. It's not a case management system for individual children. It allows us to plan services and policies. Next slide. So the Fair Start for Kids Act. In our state, we invested more than $1 billion in 4 policy objectives to stabilize the early childhood system at a time that we were losing providers, as were many states around the country. COVID just decimated the early childhood system, the workforce, the provider base. These are the 4 objectives stated in the legislation: advancing racial equity, expanding access to affordable early care and education, promoting kindergarten readiness, and stabilizing the system and the workforce. We had the benefit of being able to operationalize these definitions to identify zip codes and local geographies around the state where we could target some of the dollars so that we might be most likely to actually reach some of these objectives. And we helped, the CUSP data helped us do that. Next slide. So here we've got, as an example, 3 of the objectives that we use the CUSP data to help us with. Advancing racial equity, we used extreme access deserts analysis, expanding access to affordable care and education. That's the one I'll talk mostly about today, where we identified priority zip codes for investment, and then stabilize the childcare and early learning workforce. We did use some CUSP data for that. We were able to identify high COVID impact zip codes and did some work, but the example I'm going to share today is centered in the center area. Next slide. So, addressing expanding access to affordable care and education. Even though $1 billion is a lot of money, it's not really a lot of money considering the size of our system and the population in need. And we really try to take a look at high need areas when we have these kinds of opportunities, and not just peanut butter the money evenly across the state. If we can focus the investments in high need areas that will be, accepted by policymakers and the field as high need areas, then we believe we're going to be much better positioned to make a real difference in these outcomes. So according to the priorities in the legislation, we were able to operationalize these zip code priority factors on the left. Extreme access deserts, which I've mentioned, those are calculated in CUSP. Racial disparities in kindergarten readiness from our K-12 system, we can identify those areas, areas with high concentrations of children of color, high concentrations of childhood poverty, the high COVID impact areas, and high rates of child maltreatment. Since we are one of the reasons our agency came together in 2018, one of the reasons the legislature created us was to line up high quality early care and education as a prevention for maltreatment. So that was one of the reasons we were created. So it is in one of our high priority zip code factors. We were able to calculate those zip code factors, put them out on a dashboard so that providers and policymakers knew what they were, where we were getting the data, could understand, this isn't magic. We have data to support what these areas are. And then we used it in priority points for how we gave out the money. We didn't give the money only to areas that had multiple of these. And in the Fair Start for Kids Act evaluation report, you can see, so some of the money did go to places that only had one of these risk factors. But it did help us move the needle in terms of moving a disproportionate amount of the dollars out into the high priority zip code areas. And then when we, on the other side of giving out the dollars, Fair Start for Kids Act passed in 2021, we gave out the dollars over an 18-month period of time and then had to evaluate, did we succeed in some of these things? Some of the objectives are further out than 18 months would allow us to evaluate, things like kindergarten readiness. But some of the impacts, like were we able to keep providers in these areas and not lose providers, were readily evaluable using the CUSP data. Next slide. So I'm sorry, go back to that previous slide, Carl. So on the right side, we were able to use CUSP to help us, first of all, look at the percentage of children eligible for subsidy care who were getting subsidized care. So because CUSP is set up the way Adrian indicated, where we can swap out the real children served that we know are served for the synthetic children, we are able to measure in an ongoing, relatively frequent way the percentage of estimated children who need care and the percentage of those children who actually are having their needs met. So that was a key indicator, sort of before and after and throughout the investments. And then we also have used CUSP to help us develop this provider entry exit rate gap, right? Often policymakers are interested in, are the numbers of providers increasing, are the numbers of providers decreasing, centers and family homes. But those two sort of static measures hide the dynamism beneath it, right? That there are constant entry and exit into the system. And understanding that dynamic, being able to model it, and then being able to use it in evaluation has been really important. Okay, next slide, Carl. All right, so this was a key piece of our evaluation. This goes to the first definition I mentioned previously, are the estimated number of children or portion of children who need subsidized care getting it? Did that go down during the time we gave out these dollars or before and after? And or did it go up? And here you can see, because of how the data in CUSP were broken out, we were able to measure it for a variety of age groups: infants, toddlers, preschoolers, and school age. And school age data are the worst in Washington state. So even though we report it, there are lots of data limitations to school age data, but we think we have really solid data to do these estimates, especially in the infant, toddler, and preschooler space. And then for each of the high need zip code areas that we identified sort of a priori before the evaluation was done. So extreme, and some of these are overlapping. They're not mutually exclusive, but we can look at extreme access deserts. We actually were able to add capacity between those years during that time for most of the age groups. The zip codes that were priority for racial disparities in kindergarten readiness, we probably added the most. High concentration of children of color, added capacity, or added increased the number of children who needed subsidized care who were getting it. And you can see the rest of the results here. Just a couple of negatives, mostly positive, even in the infant space, which is the most difficult for us and many others. So this was exciting to be able to do this kind of analysis and show that we did have an increase. Of course, the next question is always, well, gosh, would that have increased anyway over that period of time? Did that $1 billion really cause this increase? So to supplement that analysis, we undertook, next slide, please. We undertook a difference in difference, and by each area, we're able to show that in most of those high priority zip code categories, the investment did induce an increase in the number of providers. The unit of analysis for the difference in difference is the number of licensed providers, but we could have just as easily done it using another metric. The difference in difference is pretty flexible, and we wanted to do it in a way that we had a unit that could be analyzed easily and understood across all of those high-risk zip code areas. So that's why we use the difference in difference. But we found that there was a causal link between the investment and the ability to not only maintain providers, but increase providers over time. That, I think, is what I have. I hope I stayed on time. Happy to answer any questions.
So any questions before to Georgia? I will say, I know Vicky knows this already, but that difference analysis is just awesome. Like that is just fantastic stuff. I mean, to be able to run a counterfactual in early childhood with early childhood data is just unbelievable, right? And I'm seeing a lot of nods here. So I gotta just give a shout out to Vicky and then, you know, Adrian with the game. I mean, this is just, I just get so enthusiastic when I see this stuff. But anyway, all right. But now let's queue up Woody, and he can talk about a different set of components and aspect to this analysis and you know how Georgia is using CUSP. So Woody, go ahead.
Hey, thank you, Chris. Good afternoon. I'm Woody Dover, Enterprise Project Management Director with the Georgia Department of Early Care and Learning. We are a do-it-all early care agency in Georgia. So basically all of the CCDF activities for states fall up under our agency, as well as our Georgia Pre-K program, and that as well as all USDA nutrition programs. So Georgia consolidated early care and education in coming up 10 years ago, so in July 2004. And the last piece of that, which was child care subsidy, came within our purview beginning in July 2012. So I wanted to share today with you all kind of our experience with CUSP. So we're, you know, I appreciate the perspectives of Adrian and Vicky. I mean, I think they really illustrated some of the really key ways that you can use this information and the platform to your advantage. Also, I think the overall model this learning experience and sharing experience is to show how every state has its own variety of unique needs, but at the same time, once when we develop these additional capabilities, that they can also translate very easily to other states. So, I mean, the things that, you know, Adrian and Vicky shared, I mean, also apply here in Georgia. And it's kind of a similar story as well. Like at my agency, we have always been a very data-rich agency, but we haven't been able to use that data very effectively. And we actually developed ESIDS starting in 2012 And I believe Elliot was a consultant on that project back then. But over the years, that eSIDS and SD eSIDS is still running. However, it was not much use internally. It was never built to be, accessible from an administrative data standpoint for the agency to use for real-time data. So that really kind of kicked off the need when COVID hit. We needed to change things and really pursue a different avenue for better access to our information. And so that resulted in working with Chris and team to sign on to the CUSP platform. Fortunately, we were able to use PDG dollars to do that in that time frame, and have now transitioning that over to regular CCDF dollars. Carl, you want to go next slide? So, like the vision that we had, as I mentioned, it's all about getting real-time data. So I'm sure others can attest to this. We've always done a lot of data analysis. We have an internal research team, of which 2 of my colleagues who run that research team are on this call. But efficiency of use, efficiency of data, efficiency of reporting has always been a challenge. So we really wanted to try to get data, integrated and at our fingertips as soon as possible. So that this platform is able to do that. In addition to that, we wanted to take full control of our metrics. And so, there's power in having access to the data in this integrated way. And it also enables you to define your landscape, be a partner to other stakeholders more readily, but also not let others define your state and your space as well. And I think that's one thing our commissioner wants is it's always challenging when another entity presents data that's supposed to represent you as a state or an agency, and you don't have anything any way to rebut or to respond. And so having that data at our hands is really impactful at this point, and we're hoping to use that moving forward to obviously affect impactful strategies, also to better use our CCF dollars to be as efficient and impactful as possible. Carl, you want the next slide? So I wanted to share a couple of our initiative, our emerging work that we're looking at. The CUSP is, some similar stuff that Adrian talked about, and that stuff that we're looking at. But obviously, the CUSP platform allows states to take that base and then begin to work off of that. And so, a couple areas we're looking at are really, we've got requirements on what are called error rate review for CCDF regulations. That requires us to better understand how well we're doing at determining eligibility for children and families in our subsidy program. To be fully honest, we're under a corrective action plan for error rate. And so, so we're working through that process to improve our ability to determine eligibility properly. And so we're going to learn a lot through that process. And so we want to be able to leverage the data of that program to avoid that corrective action process in the future, and be better stewards of our public dollars. And so to do that, we're really looking at rolling out more of a life cycle analytics of our CAPS, what we call our CAPS program, our Child and Parent Services program. But in addition to that, we're also going to be setting up what we call red flag risk scores, and that's working with our audit department to reduce risk within the agency relative to our child care programs. And so, that might be result in maybe we're using it for investigations. Maybe we're also using that to create better business rules that reduce risk and prevent the potential for fraud. There's a whole lot of different perspectives you can kind of pursue with this work. Carl, you want to go next slide? So in terms of life cycle analytics, I love the story of our subsidy program. I kind of, a lot of the data that I work on a regular basis and have for many years has been subsidy data. I think it tells a really fascinating story about what's occurring. But traditionally, the access to that data has been limited. It's been siloed. We actually have an eligibility system that is separate from our payment and provider management system. So it's created this siloed effect. So the use of that data really is also siloed. So in my experience, in my work, I really work mostly with placement and attendance data to then report out, who's being served, how much does that cost, which providers are participating or not participating. On the flip side, we have our eligibility staff who process applications, and they're using application data to help them understand like how quickly they're processing applications, what their length of time it takes to determine eligibility. But no one's looking at the whole life cycle of that process. And so the goal here is actually to begin to integrate both siloed portions of the data into one place and really tell the whole story. I think there's a lot of things that we're not telling with that data. So like, how do families progress through the subsidy program, from the time of the application to exit? So, what's one thing we're not looking at really well is like, okay, who's exiting the program after they've been receiving services? If you can tie that back to their application information, their case information real well, then you can understand, are there trends as to who's exiting, who and why they're exiting, and maybe there's something, that we need to do about that. Also, what about people who are actually applying but not becoming eligible? There's a lot of information we can understand about the demand of the population through looking at that information. So I think the possibilities are really exciting. And then obviously in terms of, like what are some of the possible inefficiencies? We want to obviously reduce barriers, reduce inefficiencies, reduce redundancies to lower, the barriers that families can experience, getting into subsidy and also to maintain their benefit through over time. But then also, I think it's fascinating just to get that just nuanced view of the data. I mean, like I said, I feel like we've just kind of been very blunt with how we use the data, meaning, okay, here's who we're serving, here which providers we have, here's who really, here's some time applications. But I mean, I think there's just a greater story to tell, and there's a lot we can learn from that. So I'm excited to work on this project in the coming months to kind of figure that out. Carl, you go to the next slide. It's just kind of gives you an idea of like, it illustrates kind of the way you can kind of look at it is like there's always, families applying, there's the eligibility determination, not everybody's determined eligible. Once again, there's things that we can learn from that. Also, what barriers potentially exist to getting a placement? What we find is that, as much as like 10 to 15% of families get eligible, but don't actually choose a provider. So they're not getting placed. So what's happening there? Why is that happening? Is there some type of inefficiency in the system that we can remove? So it's like learning that type of thing. On top of that, then you actually have placements. And then historically, even with placements, we see that roughly 25% of placements go unused, meaning we have a lot of families who get eligible for subsidy. They have a placement, so they have a scholarship that they can use for childcare, but they end up not using it on a regular basis. So why is that happening? So it's really understanding that life cycle, which I think is really important. And I think this is also, I mean, we know, many of us know that, the Office of Child Care is, changing their rules or has changed their rules. And so there's the new focus on enrollment and how we pay based on enrollment. So, I mean, this data is going to be really valuable, hopefully, to helping us understand how we amend our policies and practices to be compliant with the pay by enrollment rule that's coming into effect. Move to the next slide. Yeah. And so obviously, as you're doing that analysis, you can create, feedback loops within the agency. So we can, create the ability to publish that information internally, let people know what's going on, provide different layers and aspects of that data so that different groups can understand what's happening and figure out if there's something that they can do and take independent action, or they need to work across, cross-functionally across the agency to make that, to make policy change a reality. Carl, you want to go next slide? Okay, and then so I'm going to shift over to our, second one, our second example or this emerging work is really our red flag score. So we've actually been doing this for quite some time on a separate, in another silo. I mean, this data is all about silos, I know. But the opportunity came about recently for we have an internal auditing department that does risk management auditing within the agency across all of our child care programs. So the opportunity came up we already were integrating and using the same data that they were using to do red flag risk scores. And so their contract was expiring. So we were able to, put in place a structure to bring them into the CUS platform and actually use the CUS platform to build out their red flag scoring process. It was time for them to revamp that process anyway. And then they had their contract expiring. So it was the timing was really perfect for that. So within the data we have, what we're going to do is actually develop metrics and thresholds to help us suggest potentially non-compliant behavior that can take place. Not necessarily to be punitive, but just to be to understand what risk exists in the system, and how do we go about uncovering that risk, and and then help us understand how to target our investigations more appropriately, so that they can be more effective and impactful. But also, once again, to create a feedback loop that allows us to put in place better policies and procedures and business rules to help reduce fraud. And so what we're going to do here is I'm going to walk you through a couple of the metric examples, which are priority payments and then family distance to provider. Carl, you go to the next slide. Okay, so the first example here is our first risk score is our percent of payment requests that are high priority and that are billed above the maximum rate. So in Georgia, we have two priority groups in our subsidy program where we pay the full provider rate no matter what, and those are children in our foster care and then children with disabilities. And so what we look at here is, are there concentrations, meaning are there providers who are billing a high number of those scholarships? And to figure out if there's a reason for that. We found over time that is a risk factor for fraud. And so this is kind of the metric that we would use to help uncover that a little bit. And so what you can see here is looking at priority payments over, let's see here. I'm sorry, I'm getting lost here. I apologize. So here is the blue line represents the threshold at which that the 10th percentile, the highest percentile, I believe, is here, and it lets us know by the number of distinct children within the payment. And so we have and some of the highest ones you see here are actually smaller providers, and so I know based on the data that those are probably family providers, and so obviously if you have maybe 1 to 5 kids, just having a couple could mean you're high on this list. And we actually have a few family providers that are focused specifically on either children with disabilities or children with foster care. But as you go up in the number of children, then you realize that that's really larger providers, and so that would focus your efforts as an agency and say, okay, well, this would give you a particular score that might go into a composite score. Carl, go to the next slide. And then another one we found is highly correlated with fraud is family distance travel to providers. I can't speak to other states, but I mean, one thing we found is that in our subsidy program specifically, we have had issues over time of providers essentially having families on their subsidy rolls that don't live near them, and they've essentially billing because they can and because they have access to that family's record, and they don't live anywhere near them. So we found that if we look at outliers within distance traveled, so we can obviously have provider data, we have family data, we see family address to the provider address, and then run the analysis and come out with the scoring, and that allows us to understand to what degree families are traveling to providers, which also is a fantastic stat anyway. But also if you see that they're traveling extensively for care, that can also be a risk factor, and that also goes in that scoring metric. And that's kind of a just a summary of kind of what we're looking at. And in addition to this work, we're also working on other ways to leverage CUSP for additional analytics as well. But I'm happy to answer questions, or if no questions, I guess we'll go into the panel discussion.
Okay. I think, Christina, are we passing it back to you? And I will say that that's also incredibly exciting, and we're excited also to tie the Woody, wouldn't you say, sort of the finance department more, and some of this analysis more cohesively to the rest of the agency. And it's also useful when you're talking about provider risk, when you're looking into expansion, to be able to put those two together, wouldn't you say?
Yeah, most definitely. I think, and I actually think that that's something that our auditing and finance team are really excited about, is the fact that, in the past, they go out and do audits. They may that may result in reclaims of funding, but I think ultimately they want their role to be, you know, a feedback loop back to the programs themselves to help improve processes so that then we can actually just reduce risk on the front end. And so they realize that they're a part of that feedback loop. And if we can create that, you know, cross-functional integration more, you know, better, you know, it can actually, they can have an impact without having to go and do audits, and they can help, you know, inform the process, you know, on the front end so that we're actually just using our money more effectively.
Yeah. So thank you again to all three panelists. I know we're going to get into a Q&A, and I'm going to pass it back to Christina, but I just want to personally thank all three of you for taking the time. And I got to say also, it's great because for the rest of this crowd, we usually don't have the time to come together as a group, as an actual network. And we've been talking about this for, frankly, years about like, you know, because usually it's more informal conversations or we build it into the platform or whatever. So it's just really great for us to finally get together and be able to talk in a forum like this. So again, thanks to all three. And I know we're going to move into a Q&A now, so I'll pass it back to you, Christina.
Actually, Elliot is our moderator. So Elliot, I'll turn it over to you.
Great, thank you. And this has been super exciting. It feels like worlds colliding for me because a lot of the folks from the other states are folks I've met on various projects over the years. And obviously the Illinois team is fantastic. And I hope that it's always been a dream of mine that some years from now on a forum like this, it would be Illinois presenting. And so I hope this is today is a step in the direction of us being part of that club. But for the moment, I want to start with and thank Christina for the opportunity to be a part of this conversation too. So we've done a lot in Illinois, thanks to a lot of the people on this call and PDG funds and other important steps that have put building blocks in place. But a few questions for our colleagues from other states that I'd love to ask. One is, given the point we're at, right? Like we're still more or less in the sort of getting started place in terms of thinking about how to integrate some of this data. What do you wish someone had told you when you were at this point, right? What are the pitfalls that you ran into? What are the things that you didn't expect? Like, what was the unexpected piece that, thanks to your experience, we can now expect? I can call on people, but I was hoping folks would jump in.
I can jump in there on that. I think, at least from a government perspective, I don't think, I wish somebody had told me that what you're planning to do is not normal, and you're gonna encounter things you did not anticipate, and you don't know what you're getting into. I mean, I think that's really and I say that from someone, I'm on a stakeholder group within our own state who's working on trying to improve like data capabilities across other government levels, and that's a common theme. I mean, most people who are getting into this in the last few years, and now, I mean, it's just, there's nothing standardized. There's a lot of perceptions that you have to overcome, and you got to do a lot of convincing, and it's really a challenge at every level, honestly. But I think it's worth it personally, because if you don't do it, you're wasting all that information and the capabilities that exist there. The technology is there to help you get there. It's just a matter of having the will and the want and the resources to do it.
Adrienne, I saw you come off mute.
Yeah, I mean, well, I have to credit where credit is due. I actually came to EEC once our system was already up and rolling. So I stand on the shoulders of lots of folks who I think learned a lot along the way. But I think we talked about this already, but just the sort of building the straw person and iterating over time, like it doesn't have to be perfect to provide valuable insight. And in fact, sometimes it's the sort of imperfections that drive the thinking about how to iterate and improve over time. And so I think that's been a big learning. And then I think the other piece is that talking to folks about data that comes out of a model is hard, right? Like, I think folks are used to saying, there are 4,322 children who have X characteristic, and they can go in the data system and see who those 4,322 children are. And I think talking to folks I think it's the model nature of this work that is so powerful, but it sort of requires a little bit of a mindset shift and bringing other folks along on that journey to sort of to help folks understand how this model is built and what its power is, that I think has been a learning experience for me for sure, and I think for others at our agency as well.
Yeah, I would agree with what Woody and Adrian have said. I think in addition, as we're learning, there's so much technical learning that needs to happen, and there are a lot of technical folks at the table doing the data work. But in terms of the ways we're going to use the data and the questions we're going to answer, that involves deep engagement with our policy and program folks. And so I think just the understanding, I wish I would have had the understanding at the beginning, the depth to which we would need to bring those folks along in our conversations. This is not just a technical exercise.
Well, and that actually, it's as if you anticipated my second question and led up to it, because my second question was about the culture of data use in a state, right? And Adrian and Vicky, you in particular, both talked about that or touched on that. But there are a lot of questions about how data should be used, how it shouldn't be used, how to make the best of what you have. And this is an area, again, where Illinois has done a lot of work. I'm looking at Robin, who has been just an absolute champion for that throughout her career, and others on this call, Rebecca, and some of the work that her organization has done. But that as we think about that cultural piece, right, both inside and outside government, because again, one of the things we've done a lot in Illinois is try to have collaborative tables inside and outside government to process data together. Are there other pieces you've learned that would help us as we think about the future of our culture in terms of using data?
I think the one thing I'd add is that in addition to sort of the not waiting for perfection and being willing to iterate, I think especially when we make decisions in collaboration with external partners or even across divisions in a large agency, when we make decisions about sort of how we're going to use the data or what level of error is acceptable or what do we mean when we say extreme access deserts, that those things be documented, because those players are always changing, and having to bring up a new policy person or a new chair of an external advisory committee, having those sort of artifacts where it's clear that some decisions have already been made. There's always opportunity to revisit if those are problematic or the environment changes, but having all of those partnerships be well and decisions be well documented, I think is important.
It's a great point. Woody, Adrian, anything to add?
No, I'd underscore what Vicky said about sort of the data governance pieces as being really, really important. And then also I think what Vicky said earlier about the relationships, like we get no data work done without the program folks sitting right beside us. And I think those relationships didn't start with, let me perform an analysis for you. They started with, what are the policies that are coming down the pike for you? What are the questions you think you'll want to be able to answer in the next 6 months or the next year? Or what are those like thorny things that you've always, thorny questions you've always wished you could answer? And can we help you dig in the data to help answer some of those? And like, it doesn't come from like, here's this cool data model we have, let's talk about how you can use it. It starts with sort of like, what are your greatest challenges and how can we adapt this data model to be able to use it and apply it in ways that you're sort of interested in. And I think it just all starts with the relationships come first, and then the data support comes second after that sort of foundation is established. I think.
Elliot, can I jump in with a follow-up?
Please.
Adrian, I've had a couple of questions that are sort of rocking around in my brain, and I don't know which are appropriate if this is the right place, but what role does leadership play in that? Like, to what extent is it necessary to have somebody who is bringing those sides of the house together versus you having to kind of go and cajole and whatnot? And how much consistency, for those of you who've been at this longer than others, how hard is it to establish that consistency? Or how is it, just the luck of the draw of who's sitting in certain key positions?
I mean, I think Robin, leadership plays a really important role, and I think sets the tone for the value that's placed on the sort of data informed discussions and research informed discussions. And I think that's been a huge piece through several several episodes of leadership in Massachusetts, for sure. And I think that sets the tone for those conversations. And I think it's also possible, it's a supporting condition, and I think those conversations are very possible from the grassroots level as well. They're much easier when sort of leadership has set that tone. But I'm curious, Vicki and Woody.
Yeah, I totally agree. I mean, in Georgia, it's incredibly important to get your leadership involved to the degree you can, and maybe build, if you see advantages to go in one direction or another, take those wins where you can and just kind of go build it from there. I think it's important also, if you have a leadership, if whoever the leadership at the top is, if they buy into the vision, then that's also important because it helps, keep people focused. But I think, in addition to things like data governance, which we're undertaking now, we're also looking at developing data strategy is within in-house. So like, obviously, those are very different things. But data strategy is how we leverage our technology to understand and manage our data in the future and what use cases exist. In addition to that, our research team is developing an agency research agenda, that aligns with our strategic plan. So it's really having all these plans and strategies in place that help kind of support that leadership structure, and then helps and reinforce that culture.
Yeah, I would agree with everything that's been said. I don't know I can add much, other than the fact that sort of a data-driven approach to all of our work is embedded in our founding legislation. We're fortunate to have a ex-Microsoft executive as our secretary. So data informed is a part of who we are, and that, as Adrian said, provides a sort of enabling condition that's been very helpful.
One follow-up, because I mean, the when you've got great leadership, that's great. You can make a lot of hay. When you don't, it can create a vulnerability there. And my hypothesis over many years has been that once people get into the habit of using data, it becomes addictive, and it's just harder and harder to imagine going back and making what do you mean we're just going to shoot in the dark on this? And I'm again wondering if you see that as well, and if it's playing the role that I hypothesize that it would or that it should here, or if I'm being too rosy-hued.
I think data can help those transitions, right? Because leadership doesn't stay around forever, but like if you're using your data well and you're telling your stories well, it can help leadership transitions be easier, because the program's already defined, and it helps somebody step into that leadership that potentially can kind of step
Here's
on.
how we think about this.
Yeah, they already have a framework to look at it versus and so I think that can be helpful.
Robin, I think your hypothesis is correct. And I joke sometimes that in state government, the sign that you're doing good work is that you get more work, right? And I think that's, that's a sign in the data space of sort of a healthy data culture is too much data work that then you have to prioritize. And I think that that's a real reality, is that it sort of becomes addictive. And then the challenge on the other side is, we have limited bandwidth and lots of important questions to answer. How do we prioritize and structure the work in a way that helps us maximize the capacity that we have to answer the key questions of interest?
Yeah, and I would just agree that your hypothesis is correct, Robin.
And one last question. I don't mean to dominate, but it's a natural follow-on. Most of what I've seen here and what you guys described, which is incredibly exciting, drool-worthy kind of stuff, feels internal. Is how do we make decisions? I am equally interested in, I think we are equally interested in, what's the outward-facing role of data? Because we want everybody addicted. We just don't want you internal, agency folks. And so I'm wondering, am I missing? Is there more of this that's outward-looking than we're seeing and perceiving? And I'm assuming it's equally usable in any which direction, and that just wanted to tap into that.
Yeah, absolutely. We have a suite of early learning dashboards that we power with the CUSP data, and our stakeholders are used now to seeing it, right? There was a period of education. Every time we roll out a new dashboard, we get their input. So they have an opportunity to get their needs met, and we update them regularly, quarterly, I think. And they're used to using them now.
Thanks.
You know what? I do take the listening role seriously, but I do want to add on to Robin's hypothesis and then this idea of culture of data use. I think this is why, as we think about the new agency in Illinois and the fact that we have a 2-year on-ramp, being able to model data use with whatever data is available as this new agency looks to make new policy and new implementation down the road, that I think that I see as just as important in this particular context as just as important as any kind of championed voices at the top. Just putting that data into use as often and as much as possible, knowing it's imperfect, knowing we still have a journey, a long journey ahead, but modeling data use in the next 2 years as this new agency gets ready to fully implement programs, I think will be key too, Robin.
In that spirit, Christina, I want to pick up on something Adrienne talked about explicitly, and that I think came up a little bit with Woody and Vicky as well, which is the idea of capacity, right? That this is, the work doesn't do itself. And that as we're thinking about building out an agency, one of the things we're having to think about is what are the capacities we need that agency to have. And I know I am not speaking solely for myself when I say that I am really hoping that this new agency will have some outstanding capacity to do the kind of data work we've heard about today, right? As I know that Washington, Georgia, and Massachusetts have worked to build. So as we think about building that capacity, it would be great to hear from folks who have it about what that looks like, who's on the team, what are the skill sets you need, right? So that we can start planning for an agency that from day one is able to do this kind of work effectively.
Yeah, so I'll just say we were fortunate to have a centralized division of data and research, the Office of Innovation, Alignment, and Accountability. BI analysts are necessary for the technical pieces, as well as researchers and evaluators who can help us make meaning out of the data. And that is in addition to the IT division that manages much of the data that are used to inform this. So lots of capacity needed.
I second that, Vicky, and I've been just recently hired a few folks for the team, so I've been thinking a lot about the sort of capabilities question in building out a team. And an organization that I used to work for draws this distinction between data analysts and data strategists, and I think that's sort of this key piece here is like, it's more than just building out the capacity to sort of do the computations and do the analysis. It's sort of this being able to understand the landscape to ask the right questions and know what's going to sort of, you can do all of the analysis, forever and not answer the right question if you don't sort of understand, if you're not thinking strategically. And so I think that's sort of this piece and something that I think in hiring and interview processes to sort of listen and get a feel for it. It's not, I find that we have no challenge in finding lots of great, talented analytic folks. It's that sort of strategic piece that can I understand the landscape, understand what the key question is of interest, and how I take the available data that we have, which is often not perfect and not the data that we wish we had, in order to answer the question that will really resonate with policymakers or the program team or the public.
Robin, you got your hand up, but I wanted to make sure that if you had anything to jump in, because I know Decal has a tremendous team that works on this kind of thing.
Yeah, I mean, I think capacity is something I wish I'd understood better before. I mean, just have the degree of capacity you need. I mean, we're fortunate to have a research team internally, but even that research team has evolved significantly over the years, where it was all basically about just research, and now we have kind of two groups within our research team. We have one that's focused on research partnerships and helping us leverage third parties help us develop research, but then internal data and research as well. And so I think it's developing the right structure to provide the capacity you need to really manage your data well and use it and leverage it the best way. To Adrian's point, I mean, your data analyst, like they need to understand obviously all the technical tools, but they also need to be need to be fluid in the program themselves, you know, like understand the programs, how the programs work, what the outcomes of the program should be, and merge those two skill sets together to create really good analytics and that proper feedback loop so they can build relationships internally. So I think, and on the flip side, obviously IT is a real big part of it. I mean, IT, you need to have an IT partner within the agency. I mean, that's maybe not always the case with some agencies or some groups. I mean, but I think that has been kind of it's been challenging at times for us, but also it's becoming better as we, you know, develop the better skill sets in our IT program. But it's a multifaceted issue you got to kind of govern, and you also realize it's not all going to be within your purview. Typically, you're going to need partners who understand your needs and are willing to support you.
Elliot, if I could, I would just add
Please, yeah.
to what I heard Adrian and Woody say. Adrian, I love what you said about strategic use of data and interviewing people with that ear of strategic use of data. One of my early experiences after I hired some researchers at the former Department of Early Learning was I realized in interviews and in early work with assigning projects that when most of my check-ins were filled with complaints about how bad the data was, I knew that was a problem. So I developed sort of a way of pivoting from bad data. Okay, I understand the limitations of the data. Now show me what you can do with the data you have. I want people who are comfortable digging into messy data, and because that's all we've got is messy data. So.
Yeah. Robin, you were going to jump in?
Yeah, two connected but different questions. One, I'm just wondering, has anybody developed kind of a rule of thumb of like, these are the costs these are the kinds of investments you ought to be making at the agency level if you care about gathering data and putting data to use, so that because I think sometimes there's this is a lot. And I just wonder, you know, there are kind of rules of thumbs in business of what the R&D budget of a company or an industry ought to be. And I'm just wondering if someone has developed that so that it helps buffer against the shock. And relatedly, when you talk about it, and I appreciate the data strategist versus data analyst and the focus on, it's not about having data and presenting it to people, it's about finding out what people want data for. What are the questions and the problems, the challenges they're going to. And I'm wondering to what extent you also, it sounds like there's looping with stakeholders, but I wonder if there's any formal or informal regular advisory or governance entity that you use on a regular basis to keep it from getting too insular. Not that the agency isn't critically important, but that there is a broader group that's going to need and could inform that, to what extent you tap into that and how.
To your second question, I speak, we're in the process of developing a data governance committee because our IT group is laid out this IT roadmap for the next 5 to 6 years. And so it involves redeveloping all of our program applications. So it's an opportunity to get a lot of things better or get a lot of things right on the front end as you develop those and create because if you can create more consistency in how they develop each application, it does reduce your burden in terms of integration. And having that data governance committee to kind of be that, I think the data governance committee can be really good at cross-functionally connecting people and letting people know who they need to talk to and consider when they're making decisions. But it also just, once again, it reinforces the culture too. I think you just got to get people more comfortable with data and systems and how we can communicate data, regularly in our conversations. Robin, I didn't address your first question. I'm
going to come back to the first question, but Vicky and Adrian, if you have anything more to say about the second question.
Yeah, in terms of external stakeholders, when I was at the Department of Early Learning, we tried to set up an external advisory specific to research and data, and it didn't last. We didn't have enough, and it wasn't enough variety of people. What we found was that there are a couple of maybe 2 or 3 key external advisory stakeholder groups. And what we found was we needed to engage all or some of them depending on the policy issue we were working on, right? So the advisory need for us needs to be, is most effective when it's consistent with the specific policy issue we're working on. And those three groups have become used to seeing our data, and researcher folks go and ask questions and show them things and get their input.
Just a follow up on that, Vicki. So it sounds like, and I've had this experience, well, it sounds like it works better when it's like more of a concentrated focus versus something that's ongoing. Have you all, or any of you, had any capacity where you've partnered at least at some point with a university on certain projects? Oh, and has that been helpful, and in what ways? And could that be something that's more ongoing as well?
Yeah, sorry, what were you going to say? I was gonna sort of second what you said earlier about external university-based research partnerships and the way in which those partnerships have the advantage both of the added capacity, but also about the sort of positionality, and they can ask questions that are harder to ask as a state agency, right? It's easier for a university researcher to ask questions of the field that where they said are easier to, there are sort of more better situated to ask than the state agency. And so I think it both helps in terms of capacity and in terms of sort of the types of research that we're able to engage in. I think, there are certain trade-offs. The incentives in academia are not always perfectly aligned with the incentives of a state agency. And so I think there's sort of some, the relationship building and requires a lot of longer term partnership and relationship building. But at EC we have one especially deep long-term partnership with some university research partners that has borne a lot of fruit and requires a lot of effort, but is also really paid off in terms of learnings and insights.
What our guests from out of state might not know is that Robin was one of the driving forces behind creating a statewide research practice partnership that has been established at the University of Illinois that I think is set up to be like an absolutely critical player in exactly the ways that all of you were describing. So that doesn't cover all of the stakeholder engagement, certainly, or all of the research that we want to do, but it's certainly a critical asset that thanks to some outstanding thinking ahead, we now have in place as we try to build this integrated data system. I did want to go back, Robin, to your first point about, is there a guidebook on agency level investments for this? I don't think there is. I think maybe we should write one, right? And I was so sad that Aressa left early, except that now I can volunteer her to help with that because I think Afton's expertise would be great for that. But of course, like to Anne, I'm happy to work on that. And I suspect that Christina would be interested in that too. So
we have pulled together some initial cost by states in terms of kind of launch cost. I think when you get into full implementation costs, there's more to learn there, but just at least understanding kind of, how to start getting projects like this off the ground. We have looked at, I think, about 15 or 20 states who've done similar type efforts.
But Robin, I understood your question to be not just about the launch costs, but about like the ongoing carrying costs of having the right data infrastructure. And I think that's a super important question and one that it would be really great to answer.
It's so nice to just have people understand coming in. Well, of course, we're going to have to spend such and such on, the right kind of data structures and, staffing and contracting and whatnot.
Yes, it's easy for me to say, but I would know that if you go to the General Assembly website and scroll through the Appropriations Committee's roster, you will not find my name on it. So it's going to take a lot of work to get that done.
I was just going to second and say we spend a lot of time talking about what we call the total cost of ownership. It's such an important question, right? Which is to really understand not just the launch cost and the implementation cost, but it's truly, and even the carrying cost, but also the cost to adopt, to make sure that the whatever it is that you're doing is used and useful. And what we find is that oftentimes that is underestimated.
Is there any way, some of the analysis that you guys have shown here, and this is probably more for you outside folks, there is always the looming, it's harder to say like, well, what's the cost of not doing this? But some of the analyses, like I really appreciate here's the impact we've been able to have as a result of having the right data to make the right kinds of decisions. And I wonder if there's a way to then quantify and so here's what would have been lost had we not had it. I don't know. I don't know how much time people spend thinking about that, but I don't know that we always marshal our evidence quite as strongly as we need to on the ever important resource side.
Yeah. Well, I spend a lot of time thinking about it from a standpoint, especially before CUSP when we were consulting and we were sort of called in to states that were struggling, and the costs when you don't think about this properly are significant because then you're sort of on this road and you don't quite know how to dig yourself out of the ditch, and yet and so yeah, I would be extremely interested in, to Elliot's point, a study or studies to think about that. But our challenges has been when you think about lessons learned, nobody really wants to share those lessons. It's hard to get that type of information out in a way that you can present it consistently in some sort of, say, research paper or output that would really benefit the field. But I continue to hold out hope that that's possible.
I think, I'm sorry, I just want to say one thing
Buddy.
here, if you don't mind. In terms of this topic, I mean, I think it's hard to quantify. It's just the loss of productivity that comes. I mean, you lose productivity when because imagine if you don't, the infrastructure required for this is not insignificant, but, and then obviously it requires people, which are probably the most expensive part of it in a lot of ways. But if you don't do it, you're really living in that ad hoc world of data and reporting, and so as people turn over and leave and go to the job, you basically lose that. You have to start over again. Like, because every time you reproduce something, it's basically out of date as soon as it's produced. I think the benefits come when you start to build the infrastructure but kind of it develops itself, and it's automated to the point that you can have people come in and out, but the integrity of the data is still there, and so people can step into something that's already exists and begin to educate themselves more quickly. So I think there's a lot of, so it's hard to quantify what that is, but the fact is it results in a lot of start and stop, and that's what the world we've been living in for forever, more or less. And I think there's an opportunity to move beyond that.
Woody, I was going to say the exact same thing, which is I think it's not just the opportunity cost of on the data analytics side, but the data governance piece and I think I've recently made some hires on my team who have made me see inefficiencies that I didn't see before, that I now sit back and think why were we doing it that way when we could have automated this process and made it so much more straightforward. And I think that has I think a lot about the sort of cost of not investing in the sort of governance, and both on the sort of IT technical side and the implementing governance procedures that make processes more replicable and reduce some of the lost knowledge and transitions, et cetera.
I would say the true cost. I mean, the true cost is when you're not counting data on kids that are underserved or not served, then they often are just not counted at all. And that to be able to really to really hammer that message home, that you've got to have a way to account for everybody, because the most vulnerable children are often the one that you have the least information about, and then the cost is then even higher, in terms of the impact or lack thereof on those kids. So again, it would be fantastic to have some sort of paper, to Elliot's point, that really tackles this question and this topic, because I think it would be such a benefit to the field for sure.
I think the greatest cost, I would agree with everything that's been said, but for me, the cost is not being effective or not knowing if we'd have the impact that we want, right? What happens in public policy, I would imagine, and others, this is true in other states as well, is that, right? It's a shotgun approach. Today, this is somebody's favorite program, and tomorrow this will be somebody's favorite program, and there's no time in between to evaluate whether the first one worked before we're implementing the second one. And just, that the opportunity to be able to know that we've been effective and we've had an impact, even if that's a bureaucratic process like avoiding an audit finding, right, is just huge. So I don't know how to quantify that, but.
So these are, I mean, this has been just beyond fantastic as far as I'm concerned. Before we get to the absolute bitter end, I want to take a moment and acknowledge Samantha Eigner-Trewargy from the Administration for Children and Families, who is no longer with us here in Illinois, but we proudly count her as an alum. Sam, if you'd be willing to just sort of say a few words about your PDG, your work, and sort of the future that you'd like to see for this kind of data infrastructure and analysis, that I think would be very helpful to us. So thank you for your willingness to be here today.
Thank you for inviting me. I know I kind of crashed the meeting, hearing that Illinois was going to learn so much, and I was like, I'd love to join and find out. Thank you. I really appreciate that. But this is super cool to see all the work you guys are doing across these states, and what it takes to actually make data-driven decisions in really meaningful ways. And I guess I want to just a couple of the reflections, having worked in and out of the different evolutions of CUSP over the years, I guess, and in different iterations of different government configurations of it. I think, what is so amazing to see, I think, is one that I have long been frustrated of the perfect being the enemy of the good, and waiting for okay, well, when we can tell that this child reaches this outcome, then we can start to decide if our systems are good. And I think just being able to that's not the way policy works, and we don't have the luxury of waiting 10 years to find out if a program works, because in the meantime there's 10 other years of children being born. And so just being able to learn really quickly, not making the perfect the enemy of the good, and leveraging the technology effectively. And I think you guys heard this said, but the operational technology systems needed to collect the data are not the systems that you just heard about here. What you just heard about here lays on top of all of those systems, so that you are not grappling with the perfect data in your operational system in order to make really good decisions. And I think that's something that our early childhood field has long really struggled with, is the fact that the technology actually has to be layered on top of each other, and we have to go and convince tech people that there's no perfect tech answer. I've liked thinking about this over time, because I think it does take someone who understands that this is much more complex than just selling a product to capture the right data point, that this is really about aggregating things. You can't stop collecting Head Start data. You can't stop collecting childcare data. You can't stop collecting licensing data, but you have to be able to put all that together real time as quickly as possible and get as best decisions as possible. So it's just really cool to see I've just been frustrated by this and seeing oh wait, actually you can make a change, and this is really happening, and it's really cool. So I think I just wanted to highlight, as Elliot was saying, that I think that this is also where you see from ACF the new rules coming out, the PDG grants really trying to invest in this kind of capacity to look across different components of the system to really fuel a more global lens and allow you to make strategic decisions. And so just really excited for Illinois, and I think the governance structure and thinking right up front about what kind of capacity you may need to be able to do this, and not replacing those operational data structures that may need to go and continue to operate and function at a day-to-day level, but not using that as an excuse not to make the big, hard decisions around how do you build capacity to answer the really tough questions that don't sit within one single system. They sit above all of those systems, because that's like, kids don't live in one system. Families engage across those. And then it takes time. And I think I will say, just to say the time it took, I love personally hearing all of the work that Adrian did, because I think your first day was like one of my last days in Massachusetts. So just like, sorry, I didn't mean to interrupt if you're gonna add, but
No, I was gonna say I was gonna say that I think this work stands on the shoulders of much work that you did even before my arrival. So grateful.
So it takes time, but it's possible. And I think the work you guys are doing and the in all of your states, but is just like so worth it in the end, because that's the kind of conversation that can really improve lives and drive like the right kinds of dialogue with the right kinds of stakeholders. So that's my just little ACF, like, this is really exciting and possible, and exciting to see how this and how a federal investment coming down the line might actually even proliferate this kind of really amazing work. Elliot, I don't know if that was exactly
No,
what
that
I
was
was saying, but I'm
perfect.
just so excited.
Could I-
No,
could I
great.
ju-
I just, I
Well-
was just, sorry, Christina, I just wanted to say that, you know, Sam, just so you know, not only do we fully understand that this sits on top of those operational systems, but that Christina and I have definitely been talking about those systems as well. And Chris and I have been talking about how this part sits on top of those systems, and how all of the, you know, like that we hope that like there's a quantum leap coming on multiple fronts. So we're working toward that and are excited to keep having those conversations. Christina, sorry, please go ahead.
Yeah, well, I don't want to miss the opportunity. Sam is being modest. She's entirely part of the origin story, at least the story that I got to join in Chicago. And so, you know, several moons ago, I think it was 2016, 17, when Sam was at the mayor's office in Chicago, she was talking about opportunity cost. She was spending her weekends Excel lookups trying to match unique counts of children. And that was not a good use of her time. She is obviously extraordinarily talented. And that began this effort in Chicago to bring in 3SI initially to do the launch of the Chicago's early childhood integrated data set. And it's since evolved, and many of the issues that came up today around capacity and early childhood expertise and strategists are very much in play there. And those are very much lessons learned for us to continue to think about and incorporate as we think about a statewide version. But I couldn't miss the opportunity to say, Sam, like, we all are here, and very much because of that early work that you did when you were still in Chicago.
You're very kind. And I feel like my memory is just being so frustrated, the fact that like, we know what data we want to be able to use to answer these questions. It's not a lack of like, and I, for the first time, entered into government, or second time, but and it was like, but it just doesn't exist. We can't get it that way. And so I'm just so thrilled that like, it's starting to exist, because this is how you can make really smart decisions on behalf of children and families, and really tough decisions, because that's what confronts government. So, thank you. That's very kind, but I feel very humbled by all of the amazing people doing amazing things in front of me. So thank you all for all that work.
So Christina, I think, I guess I'll say, does anyone else have any last questions or thoughts before I hand it back to Christina to wrap it up? All right, well, Christina, thanks so much for putting this all together, and for inviting all of us to be a part of it.
Well, again, 2 hours of just authentic and really inspiring insights, both in terms of what's possible, and also the engine that it takes, the journey and engine that it takes to pull it off. And so appreciate the perspective here. Just quickly, for an Illinois context, this is, again, you know, the learning series as the primer to launch the TAC work group focused on data and learning and putting together those strategic pillars. I'm so grateful that the TAC members on this call had an opportunity to hear what is being done in other parts of the country, and to even have those conversations that Elliot walked us through around some of the implementation needs around, you know, capacity, cost, partnerships, data governance. That's all part of it. And so to have you all having that conversation upstream as we think about this new agency is key. And I'm very fortunate for your time today. So this conversation will go in and land now in that TAC work group that we'll be setting up, and a few of you are already a part of. So thank you so much for your time. Anne, is there anything else that I missed that you'd like to share? Any other parting thoughts that you have listening to all this?
Just to echo the thanks, I know that you guys have 1,000 other things waiting for you on your desk and in your email box, and appreciate your time to be here with us today and share today. I know it's lovely to share with both the excitement of what's been going well, but it's also sometimes very vulnerable and hard to share the things that you are struggling with, and just really appreciate your transparency and openness to learn together. So thank you so much. And thank you, Christina and Elliot, for making this a great use of time. I appreciate everybody being here.
Thank you.
Bye, everyone.